Hi, today we're going to be demonstrating a CVC lumen cap change. So the first thing we're going to do is go ahead and go to our medication room to prepare our supplies. We'll wash my hands. And then I have my lumen cap. It is intact. Expiration date 2/28 of 2025. And then I will grab my normal saline, my flush, remove the cap, open my lumen packet, place it on the lumen, and I'm going to inject a little bit until I see the drops at the top. Very good. So now we're ready to go see the patient. I'll get my supplies. Hello, Mr. Sambam. My name is Aristea Cavazos. I will be your nurse today. If you could please tell me your name and date of birth. Mr. Sambam, date of birth 12/3 of 75. Very good. Go ahead and wash my hands. Today we're going to be changing your lumen out. So I will be laying you flat without any pillows, having you turn your head to the left and stop breathing when I indicate you to do so. Will that be all right? Yes, that's fine. Do you currently have any pain? No, I don't have any pain. Okay, any allergies to medication? No, no allergies to medication. All right, so I've already wiped off my area. Go ahead and put my supplies on here. Wash my hands. All right, the first thing I'm going to go ahead and do is inspect the area. So I'm going to palpate. I'm looking for crepitus, bogginess, for any JVD, any discharge or malodor, which he has none. I'm also inspecting all of the lumens to make sure they are fully clamped, which they are. So I'm going to go ahead and get started. Mr. Sambam, I have him upright for illustrative purposes, otherwise he would be flat on the bed with his head turned to the left. So I'm going to go ahead and put my mask on. All right, Mr. Sambam, do you have any questions? No, no questions. Okay, very good. So like I said, when I ask you to hold your breath, you're going to go ahead and hold your breath until I ask you to do so, okay? Okay, very good. Okay, so I have my mask and my gloves on. Now I'm going to pick the lumen which to change out, which is right here. All right, Mr. Sambam, go ahead and remove the cap off of this one. Okay, on the count of 3, you're going to go ahead and hold your breath. Ready? 1, 2, 3. Change this out swiftly. Okay, you can go ahead and breathe again. I'm going to go ahead and open my clamp. I'm going to pull back, and he does have good blood return. Now for 2.5 mLs, I'm going to push pause. Okay, for the last 0.5, I'm going to create positive pressure as I close the clamp. Okay, go ahead and remove that. We will put the protective cap back on the lumen. This is just simulation, I don't have an actual one. Okay, the last thing I want to do is go ahead and inspect the lumen to make sure they are all clamped. All right, Mr. Sambam, you're good. So now we'll go ahead and give the patient his pillow bag, place him in a comfortable position, lower the bed. Okay, I'm going to go ahead and remove my equipment, wash my hands, and proceed to the appropriate documentation.